My name is Marjan Rafat. I am an assistant professor at Vanderbilt University in the chemical and biomolecular engineering department. I also have secondary appointments in biomedical engineering and radiation oncology. And the title of my project is Radiation-Induced Pre-Metastatic Niche Formation in Breast Cancer Recurrence. I went to MIT and I studied chemical engineering. And even at that point, I always knew that I wanted to solve medically related problems. But I found that my love of math and engineering type problems really led me to that chemistry field. And even though, again, I wanted to always work on these medically related problems, I'm very happy for having that background in chemical engineering, because what it really taught me was not what to think, but how to think and how to solve problems. So I went to Harvard. I got a degree in engineering sciences, but it really was in the biomedical engineering realm. And I was studying how to better treat brain aneurysms. So not yet in the cancer realm. But a lot of what I learned in my PhD is actually translatable to what I'm doing right now, designing certain basically models in the lab that I can use to study these more complex processes. And I then moved on to a postdoc in radiation oncology. As an engineer, I learned how to solve problems really well. But if you're not focused on, I'll say, the right problems, or problems, let's say, that have a clinical impact, then maybe my impact wouldn't be as great. So I realized that the way that people ask and answer questions was completely different from the way that I was taught, essentially, or the way that I was brought up in that realm. So I found it really advantageous when I moved on to Stanford in my postdoc to be able to learn from a different group of people. In terms of the project itself, the overarching goal is to understand the role that the damaged tissue environment plays in modulating relapse after therapy. So what does that all mean? Well, first of all, in breast cancer, which is our focus, a typical treatment regimen consists of surgery to remove the primary tumor, chemotherapy, which actually can be given before surgery, and that's a systemic treatment, and then radiation therapy to the site where the tumor has already been removed. And radiation has, I should say right now, overall has been shown to reduce the rates of local recurrence, especially when compared to surgery alone. By and large, across multiple types of breast cancer, radiation helps. Where we're unique is that we are trying to understand when these treatments don't work, why is this the case? Basically, we're trying to understand in terms of, after all of this therapy, how does the environment itself change after therapy to make this environment more conducive for cells from elsewhere to come back to the site? This is, I would say, a very novel way of thinking about this problem, because again, by and large, radiation works. But when it doesn't, and we found that it doesn't when patients are immunocompromised. So when they lack a certain type of T cell, and they don't recover the certain type of T cell after therapy, after radiation therapy for a prolonged period of time, that leaves room for other immune cells like macrophages to come and infiltrate that irradiated site. And we found that those macrophages are what's causing tumor cells to be recruited to them. So with this project, we're trying to understand what are these conditions that are causing, again, these tumors to come and infiltrate these sites. So not just in terms of macrophages, but other immune cell types. On top of that, when you have these different types of immune cells that are trafficking into these sites, how does that change the environment itself? And one of the ways that we're looking into this is through the extracellular matrix, which is basically the scaffolding around the different cells, where again, cells can come adhere to these sites. They can put in their own extracellular matrix as well. But basically, in the presence of these excess macrophages, how does that environment or how does that extracellular matrix change? So we're looking at those composition differences. And again, how can we prevent this? So we've already started looking into an FDA-approved drug called Maraviroc that is actually FDA approved for HIV, but we're using it in a different context to stop these macrophages from infiltrating. So how does using that drug, again, change this environment? And that's the first arm of the project. And the second arm is really to understand how cells are communicating with each other. So I mentioned that there's surgery, chemotherapy, and radiation. Well, in this radiotherapy, of course, the tumor's already been removed, and you have a little bit of a margin of normal tissue. So that's really the space that we're looking at, is the normal tissue damage. Usually people focus on the tumor cells, but we're looking at these normal tissues and these normal tissue cells, trying to understand how they communicate in these different states. Cells of pretty much every type release something called an extracellular vesicle. And a couple of decades ago, people thought that, well, extracellular vesicles were just cellular junk. But now we have been learning that they're very valuable in terms of how cells communicate, to get a cell to go from one place to another, to get them to divide, to get them to become more invasive or aggressive. So we're really trying to understand this space. So under these different immune conditions, after this radiation damage, how are the cells talking to each other? How is that changing? And again, how can we prevent these tumor cells from trafficking it? I think we are looking at this in a different angle, because usually people think that, you know, if you have a recurrence, it's because you miss cells or cells are resistant, which I think is absolutely a factor. Our argument is that we're getting so much better at these therapies that, you know, it's less and less likely that we're just missing some of these cells. That another potential mechanism could be cells being trafficked in from another site, from another, let's say, a micrometastasis or a metastatic lesion elsewhere. That these cells are picking up signals to come back to that damaged site. We have two main collaborators. One is Dr. Rizia Barden, and she is in the chemical and biomolecular engineering department. And in terms of the second aim, when we're thinking about cell-cell communication, well, we have a world expert in extracellular vesicles at Vanderbilt. She's at the School of Medicine, and her name is Dr. Alyssa Weaver. It's been really great to have my students sort of walk over there, be able to see a brand new technique and to talk to experts in this area, so we don't essentially have to reinvent the wheel. I think it's really important for my students to be able to not just to work into my lab and sort of be isolated, but to go to other labs and see what other grad students or postdocs are doing, see how other labs and other groups are asking and answering questions, and really learning, again, in a broader manner, so that, kind of like I said with my background, it's very interdisciplinary, so that we can essentially think bigger and ask the right questions and answer the questions in the right way.